All right, so we'll do open suction with the tracheostomy tube patient. Again, I've got the flows and everything off as well as the vacuum so that I'm not having to speak over everything. But again, just to reiterate, you'd want to make sure that you're testing your suction pressure, your vacuum pressure. Always verify what the, well, we can verify what the delivered amount of oxygen is. There's a difference between FiO2 and FiO2. You've got the fraction of inspired oxygen, that's what the patient would actually inhale. And then you've got the fraction of delivered oxygen, that's, for instance, if I look at this one, I've got it set at, it's at 35% right now. So the delivered oxygen amount is 35%. A lot of people would document that that's the FiO2, and not to get too hardcore into stuff, but in order for the FiO2 to truly be 35%, you would have to make sure that your total flow output, remember your air to oxygen entrainment ratios, your total output flow would need to meet or exceed this patient's peak inspiratory flow demand in order to truly be 35%. So that being said, you may want to hyperoxygenate your patient. So you can do that. If you wanted to manually ventilate with a bag valve mask, you can do that. Or you got the trach collar on the patient, the tracheostomy collar on the patient already. You can turn this collar to 100%, and that'll hyperoxygenate your patient. That being said, though, we started off with our air to oxygen entrainment ratios. Understand that whatever liter flow this is at, so if it's at 10 and you turn this to 100%, there's no longer any room air being entrained in that system. So it's just going to be 10 liters of 100% oxygen that comes through this tracheostomy collar for this patient. So I would go ahead and max out your flow meter if you're going to be doing that, switching it over. That way you're providing, because this flow meter is calibrated at 15 liters per minute, but it can definitely put out more than 15 liters per minute, but it's calibrated to let you be able to measure 15 liters per minute of flow. So I would max that out, have your patient breathe in as much 100% oxygen as he can for your hyperoxygenation procedure. You're assessing your charts, talking to your patient, letting them know what's going on. And then when it comes time, so I've got this wrapped up. You would still utilize your sterile procedure with this. You got your sterile gloves on, so I can utilize my sterile hand and my clean hand to go ahead and attach my suction catheter. Again, if you needed to dip it in water, what have you, you can. When you're ready to make suction, let them know. I'm going to go ahead and go down your tracheostomy tube with a suction catheter. I'm going to clean that out. So you can take this and slide it out of the way, this being the tracheostomy tube collar. Now you can utilizing sterile technique, utilize your sterile suction catheter without, you don't want to miss. Make sure you go down the center of the tracheostomy tube until you meet resistance. It's going to cause you to cough, meet resistance, pull back just a little bit, occlude your suction port. You can move your fingers around all the while withdrawing the suction catheter, roll that back up. Now you're able to pre-hyperoxygenate again post-procedure. So if you do an assessment, and a lot of times the patient's with it and coherent enough, I'll ask them, do you feel like we got it all? Do you feel like I should make another pass? If they nod yes, I'll say, okay, catch your breath, we'll make another pass. Ready to make another pass, pull this down, maintaining sterile technique, go down the suction, or go down the tracheostomy tube till you meet your resistance, pull back, apply your suction, rotate your fingers back and forth, and now you can post hyperoxygenate while you dispose of your catheter. And then don't forget to make sure that you return the patient back to the amount of oxygen they were on before you left, and then you can tweak your flows, because obviously the lower you go with that percentage of oxygen, the higher the output flow is going to be, because it's got to entrain more air to create a lower amount of oxygen that would be delivered to the patient, ultimately inhaled by the patient. So you also want to make sure that you snug up the tracheostomy tube collar. General rule of thumb is make sure you can get 2 fingers up under it. That way it's not too tight. If you get more than that, it would be too loose. You want to make sure that you just snug it up so that it doesn't have a chance. And if you needed to, I'm just working with half a torso, but there's also a clip on this aerosol drainage bag. You can't see it in frame, but it's lying on the floor. You can clip it at the lowest point, so the condensation, so the water as it rains out of the particulate water that's going to collect on the inside of that corrugated tubing can drain down to the lowest point and collect in that aerosol drainage bag. So that would be about how you could go through and do your sterile open technique suction. Now, I will tell you, it takes a little bit of coordination. That wasn't terrible to be able to maintain a sterile field to go through and do that. But I'll show you an adjunct that you can utilize, in the future, without having to, utilize sterile technique per se. So you can go get a brand new Ballard suction catheter. Make sure that it's set up and ready to go for suction. I've got it capped. It comes packaged separately, but here's a little piece that's an Omniflex. So you can take your Omniflex and go ahead and put it in there. It's just going to give you a little bit of flexibility with attaching the suction catheter to the tracheostomy tube. So one thing we can do here is take your manual ventilation, your bag valve mask, This does increase dead space a little bit, but you're only going to be utilizing it for a short period of time because you still got your exhalation valve here. So if you wanted to, you can take the tracheostomy collar, move it to the side, and now you have the ability to attach this to the tracheostomy tube, and you can breathe 100% for your patient. And because this mannequin doesn't have a set of test lungs in it, I can't actually deliver a breath, but you can breathe 100% for your patient. And then after you've hyperoxygenated with a few breaths, or for 30 seconds to a minute, you can now take and suction your patient, attach your vacuum tube in here from up here. I'll go ahead and take the time to do that so I'm not halfway doing anything for you. And then support. Now, I will tell you that with that Omniflex, you're going to want to make sure that Omniflex is pretty well straight, because if it's not, you're going to have difficulty getting past those ridges in that corrugated tubing. But you'll go down until you meet your resistance, apply your suction, and pull out. And again, if a second pass are warranted, but then you can take this off, return your, you could give a couple 100% oxygen breaths before you take that off to hyperoxygenate, return your patient back to their tracheostomy collar of 35%, wherever you've got them on, assess their breath sounds, make sure that they're good to go. And then this stays clean and sterile to this patient as long as you keep this covered or capped. So you can take a cap and put in the end of it, and if you've got to ever suction your patient again, you've got a sleeve catheter that can be used for that patient again when we're ready to do that. So that's all I've got for open technique suction of your patient. Go ahead and turn this off.